Hi, so today my group is going to be presenting a clinical role play on paranoid schizophrenia, which is a type of psychotic disorder. So the diagnostic criteria for paranoid schizophrenia, according to the DSM-5, you have to have 2 or more of the following in at least a 1-month period. So you have to have either delusions, hallucinations, disorganized speech, catatonic behavior, and some negative symptoms, so like they're not super noticeable, like diminished emotional expressions. And in addition to those, you have to have a significant decline in self-care and less focus on work and relationships for at least 6 months. And it can't be due to the physiological effects of a substance like drugs or alcohol. If there's a history of autism or communication disorder in early childhood, the diagnosis of schizophrenia will only be made if prominent hallucinations or delusions, in addition to other symptoms, are present. So the prevalence of schizophrenia. Paranoid schizophrenia, occurs in about 1.1% of the population. It is the most common subtype of schizophrenia. So the specifications for the prevalence: male to female ratio of 1.1 to 1. The average age of onset. There is no specific culture that is more prone to developing schizophrenia. It's equal among all cultures. However, there is a male to female ratio of 1.4 to 1. The average age of onset is late adolescence to early adulthood, so about 18 to 30. Onset in males typically occurs earlier in life than females. It's very unusual to see schizophrenic symptoms after the age of like 45 and before the age of 16. No one's really 100% sure what causes schizophrenia or paranoid schizophrenia, but it could be linked to genetic factors, it could be due to environmental triggers or abnormal brain development during pregnancy, or maybe asphyxia during childbirth. Most people with schizophrenia tend to have smaller temporal lobes.
The therapy we will be using in our session is psychoanalysis. Psychoanalysis came into being in the early 1890s through Sigmund Freud, an Austrian neurologist, and was later developed by his students Alfred Adler and Carl Gustav Jung. The heyday of psychoanalysis was during the 1950s and 60s, when the advocacy of the use of psychoanalysis to treat the mentally ill became popular. The 3 main disorders that were treated through psychoanalysis were schizophrenia, autism, and obsessive-compulsive disorder. The main cause of the heyday of psychoanalysis was due to Freud's major contribution. The role of psychoanalysis today has caused contemporary American psychoanalysts to put a greater emphasis on human nature of the therapeutic relationship, a greater emphasis on the mutuality of the therapeutic relationship, more of an emphasis on the flexibility, creativity, and spontaneity of the therapeutic process, and a more optimistic perspective on life and human nature. The major effects of the cause of psychoanalysis today has caused many prominent feminist psychoanalysts to raise important questions about the dynamics of power in the therapeutic relationship and reformulate psychoanalytic thinking about gender. And also, recently there has been a massive influx of clinical psychologists into the post-grade psychoanalytic training institutes in the last few decades, and this has led into intellectually interesting changes in the discipline that was traditionally dominated by psychiatry. The aim of psychoanalysis is to try to bring out repressed feelings into conscious awareness where the patient can deal with them. By gaining insight into the origins of the disorder, patients can work through buried feelings and take responsibility of their own growth. The general approach is to use different techniques, such as free association, dream analysis, and psychodynamic therapy. Psychoanalytic therapists aim to undo the suppressed emotions and experiences, as well as help the patient resolve hidden traumas and conflicts that could have caused schizophrenia. Speaking about their problems can help ease their stress, as they now have someone to talk to and tell their issues. Having a therapist that listens and befriends the patient can make them feel as if someone believes them. In our therapy roleplay, the therapist is attempting to understand the patient's stressors by free association and critical evaluation. This can help the patient confront and realize a solution to their own problems that will help them to improve their well-being and possibly their disease. The medications we would prescribe to a schizophrenic would be antipsychotic medications such as fluphenazine and benzotrofine to control tics and shaking, as well as we would use support groups, cognitive therapy, behavior therapy, and psychiatrists to help treat schizophrenia.
You must be Alexis. I'm Dr. Yang.
Nice to meet you.
Pleasure to meet you. I hope the weather wasn't too bad for you.
No, my parents made it through this fine.
Is something wrong?
No.
Alright, well, I'm a cognitive therapist and I've been practicing for 15 years. From what I heard, you just graduated from high school. Do you have any future plans? Any specific major you want to study in college?
I don't really know what I'm gonna do about college. I mean, my mom made me get a job so I can work on my social skills. So now I work at the grocery store down the street.
I see. And how's that been?
I don't know. It doesn't seem to be going as well as I thought.
How so?
Well,
Is everything alright?
I mean, yeah. Well, I don't know. People at work are talking about me. I know they are, because I can hear them. And I know they're talking about that time I bumped into Grace.
Who's Grace?
Grace is a friend. I mean, I like talking to her.
Anything else? You're free to say anything here.
She's just like the others. I know it. She talks about me too.
Are you sure?
Well, no. Sorry, I just don't know, but I know that all my coworkers are talking about me. I can't stand it. I saw them filming me in the back room when I was eating lunch. They were holding their phones and laughing at me.
That's right. That's right. They're always watching you. They're always watching you.
I like Grace, but I just don't know about her. I think she's only talking to me because she's trying to record what I'm saying. I think they're all trying to film me and send it to the government for experiments. I think it's because I'm getting too close to Grace.
Do you think there's something more to your feelings about Grace?
No.
Don't tell her anything. She's trying to say that you're gay, okay? She's recording you too. Leave this place.
Did you hear that? I think there's someone.
Alexis, there isn't anyone here. I promise. I promise.
I heard it!
Alexis, take a deep breath. Here, take some water. Don't worry, it's just tap water.
She just wants you on your side. Don't drink it.
Do you feel unsafe at work?
I mean, a little. I don't really want to work there, but I don't have a choice.
Why? Don't worry, patient confidentiality.
My mom is always pressuring me to find a job and go to school. So I got a job, but I don't know what to do afterwards. It's kind of stressing me out. I want to make them proud, but I don't know where to begin. At home, it's always loud, so I can't study well, and I'm worried about college. I can't think clearly when I study.
I see. Around there, there's usually a lot of commotion, like taking tests, finding a career, and a college.
Yeah.
And now you have this job with its own set of issues and grace.
Yep.
Alexis, I just want you to take it slow no matter what your parents say. I know that you are smart and I can see that you're still nervous with your condition. As for work, if you don't feel comfortable there, then we can look into different types of jobs together.
It's my parents. I gotta go, but thank you.
Hope to see you again next week. Alright, take care.
Our therapy session was based off the case study of Bill McClary. He was 25, single, unemployed, and lived with his sister's family. He only went to see a therapist when she noticed Bill's self-talk and unorganized speech. After a few months of therapy, Bill was believed to have paranoid schizophrenia. He had both positive and negative symptoms and had the delusion that people were making a film about his homosexual experiences. In the meantime, he was also struggling with his sexuality. He often heard frequent male voices talking about his sexuality and argued with them. Bill felt people watching him. When he graduated from high school, he could not decide on a major, so he decided to take a job as a bank clerk. In addition, his mother also pressured him to find a woman. Some of these stressors were found during the therapy session. Afterwards, positive reinforcement and medication were used to help Bill and his delusions.